Okay, so we are recording right now. And with that, again, thank you so much for joining us today. My name is Danny Anchia. I'm with the ESRD Network of Texas and our quality improvement team, Arlandra, Taylor, and Mariam Alabud are also joining me in this webinar today, and they will be assisting answering the questions in the chat. Again, this is a recorded event. The slides and the recording will be made available later this week. If you have any questions, submit those via the chat. So thank you again for everything you've done in 2020. It's been a crazy year to say the least. And now our contract has been extended another 3 months with instruction from CMS to implement a new transplant change package. Some of you will be also attending a different call for a home dialysis change package. So for this particular project that is going to go from now until the end of February, we are looking at those two different packages. For today's purposes, if you are joining this call is specific to the transplant section of these packages. Again, this is only for the transplant section of these packages. If you've been notified that you are in the home change package, then your call is going to be today at 1:30 after this call. Moving on, we selected approximately 20% of the facilities for each package. So for this transplant initiative, there are 153 facilities in our network. All these facilities are part of the ESRD treatment choices, the ETC model established and required by CMS. If you don't know what that is, you can check with your regional director. I am sure that they know what the ETC model is, and if you guys are in this ETC model as well from CMS. Only one or two of the facilities of the 153 are in the ETC model, but all the ETC model facilities in the network are participating in either one of these projects. So for transplant specific, all the facilities that are included here are below the national average. The national average as of 2020 was 15.26% of patients on the transplant wait list. And so facilities that have less than that or that have placed less than 15.26% of their patients on the transplant list during this year are on this project, and that's why. Another thing is we gave you an option to complete a root cause analysis and also a feedback form. And we try to honor as much as we could your preference for the project, whether it was transplant or home. And as you can see on that little chart, 60% of you wanted to do transplant or chose to do transplant as a preference, and 40% chose home as a preference. So we try to balance and honor that request as much as we could. But so hopefully you got your wish. And if you didn't, we make sure that we look at all the options and we determine based on your rates that transplant was the project for you. Within these facilities, there are 12 facilities in rural areas, and we also applied an exclusion criteria for facilities that have less than 10 patients, and also facilities that have more than half of their patients older than 65 years old. And on those, there were only 8 facilities, I believe, that met that criteria, so not very many. So here are some of the outcomes that were able to obtain this year. As you were aware, we had a modalities QIA started this year in January, and then when COVID hit, everything was suspended, but we were still required to promote transplant. So from January through October, we've been promoting transplant and working as a team with you guys and the patients and the transplant centers. And so a total of 156 facilities were the focus group for this modality program. And we were able to add a total of 2,200 patients to the transplant wait list within these facilities and met 87.4% of the goal. So I just want to mention that we were not able to meet the goal, which was 100% represented by the dotted red line. So as of October, we were able to meet 87% of the goal. that was established by CMS. So we still have some work to do. As you can see on the right-hand side with the bars, we are right below the national average. The national average or the national percent of patients on the transplant wait list is 15.26%, and Network 14 is right below that average at 14.81. So that's another reason why we have to continue to promote transplant and see if we can meet number one, the goal established by CMS and meet 100% of that, and also try to balance our rates against the national average and at least meet the national average standard or maybe even more if possible. So this is just some data from the network in general. You can see that the count of prevalent ESRD patients in the network is pretty spread out. But for the most part, we can see that the majority of these patients that are already receiving treatment are doing dialysis. And out of 71, almost 72,000 patients, this is based on data from earlier this year, May 2020. Out of 72,000 patients, only 17,000 patients are doing transplant. The other problem is those were patients who are already doing dialysis or being treated. The other problem is that the number or the percentage of incident patients, these are new patients coming into ESRD who need dialysis or a transplant. It's very significant here, the fact that the majority of these patients, 97.5% to be exact, go straight into in-center dialysis. And so we need to do a better job trying to educate the patients and at the hospitals too and the physicians so that we can start seeing more patients getting on the transplant wait list before they go into dialysis. But also once they come to your center, the goal is to get those patients on the waiting list like within the first 3 weeks. At least get the process started, not on the wait list, but get the process started. Do the referral, have them do their first appointment, and get the workup going. Because the longer they stay on dialysis, the harder it is for these patients to choose a home modality and to get listed on the transplant wait list. So that is where we are right now. And again, that's the importance of driving transplanting, trying to get as many patients on the waiting list. The other part of that is the executive order that was given last year and signed on July 2019 to promote transplant and home. So by 2025, the government wants to see about 80% of the patients coming into ESRD already being listed for transplant and also doing more home modalities. So for the RCA, the root cause analysis and the survey that we asked you to complete earlier this month, a couple of weeks ago, these are some of the responses that you guys provided. So thank you for that. And as you can see, you guys reported that patient lack of eligibility is a big issue. And I agree, there is a lot of that. And also there is lack of motivation or family support. And then lack of socioeconomic or financial means. Those are the three biggest ones, and I think they all relate to each other. And many times, eligibility is one of those things where you need to sit down with the patient one-on-one and figure out what are some of the barriers. And in a lot of cases, we've been able to overcome those barriers and get those patients that we thought were not eligible. We are able to get them listed. And so it's something that you have to continuously work. And I know you guys are doing the best you can, especially with the pandemic. But it's something that we need to keep in mind as we move forward with this project. So here are some of the general interventions that we have been able to implement so far. Obviously, we start by sending a notice to all the facilities. So you should have received an electronic notice already. And then if you haven't received one, let us know so we can send you one and you can keep it for your records. But within that notice, email notice, we included the preference form, which also includes the root cause analysis and pre-survey, and that was due on December, I think it was December 4th. Yes, that was due on December 4th. So if you have not completed that, even though it's past the due date, you can still do it and provide your feedback to us. It will be helpful to have that data on file for sure. Also, you will receive credit for completing that specific section. Now, we provided a collaborative call. It was a demo. It was a presentation on TX Connect, which is a program that is growing and is becoming more popular within the transplant centers. And this will allow dialysis facilities to make referrals directly to the transplant center and provide all that information electronically. Even if you use a fax, they get it as an electronic format, and it makes the whole process easier. So if you want to learn more about that, this presentation was given on the 10th. A lot of you attended, but if you want to review it, it's posted on our website and also in our portal. And Arlandra is going to cover the portal section of that here in a few minutes. Now, at the network level, we have been working with the transplant centers and the OPOs, which are the organ procurement organizations. And we had a few collaborative meetings in the last few months. And so the idea is that we share barriers and we try to come up with ideas to facilitate the process and for the transplant centers to make it easier to go through that process with the patients and also to communicate better with the facilities. So this is an opportunity that many of you, if you're interested in attending these calls, just let us know and we'll be happy to include you so that you can also hear what's happening at the transplant and the OPO centers and maybe interact and provide your feedback as well. There's always going to be tracking and monitoring like we always do. So there's going to be a monthly feedback survey due at the end of the month. And this is for the next 3 months since this is an extension project. And then obviously we are going to cover the change package interventions. And these package interventions are coming straight from CMS through the NCC, which is the National Coordinating Center of ESRD Networks. They are the contractors from CMS, and they basically communicate what CMS wants to do to the networks and down to the facilities. So it's all connected. The Transplant Trailblazers is a new program. It's basically or very similar to a peer mentoring program where we want the patients to be involved, to be champions, and to share their experiences and expertise and basically become a liaison between the patient and the process for transplant. We are asking each facility to select and to identify and to work with at least one patient who can be a transplant trailblazer in your facility, maybe a patient who was there before, obviously receive a transplant and is not there anymore, but that you have a good relationship with that patient and talk to them and see they will be willing to provide support, maybe even get on the phone and answer questions or do a virtual lobby day with you guys. Just get creative. But CMS wants to see more patient participation from that standpoint. To help with that, the network has a PAC, which is a patient advisory committee. We have a few patients who are experienced and subject matter experts in those areas. And so we are going to provide some educational videos or resources and also interactive calls with these PAC members. These are patients, like I said, who are very active, very engaged, very involved in the process, and they will be working with the network, and we will be scheduling calls at different times of this process or this project so that you can invite your patients to attend these interactive sessions and have conversations with our PAC members as Trailblazers as well. There is a high kidney patient education video, and this is for the patients who have a high index of rejection, basically, and it will give them good idea of what their outcomes could be based on their KDPI score. Is available on our website, and it will also be available here by clicking on the link on the video that you see on the screen. And if I have time, I will play this video towards the end. I believe it's like 2 minutes and 5 seconds or something like that. But this is a video that we are asking you to share in your facilities with your patients. You can play it in the lobby. You can just send it to the patients, but also is accessible through our website and also our portal. There is a kidney transplant hub that was created by CMS through the NCC. That link is also going to be provided so that it can be shared with the patients. And also, we are actually giving you some CEU courses. The idea is that staff, the facilities, will be able to complete at least one of these two. You can do both of them, but they are free. You just have to log into the page, and the links are going to be provided here and on the slides as well. And you need to complete one of those by January 15. If you have a PCT who is very engaged and who can be a conversation started for transplant, we highly recommend that. We know that the PCTs spend the most time with the patients. I remember my PCT days and also my nursing days on the floor, and to this day, I know that we do a lot of work, but we also spend a lot of time with the patient. So having an engaged PCT who's willing to learn more about transplant and at least get that conversation started and see if a patient is interested is going to be key to improve your transplant rates. PCT will be encouraged to complete these two courses and will receive CEUs that you can use towards the renewal of your certification, or if you are a licensed professional such as a social worker or a nurse, you can complete these courses too, learn more about transplant and get some EEUs that you can actually use towards your certification or license renewal. And with that, I get to the last part of my presentation here with the Transplant Trailblazers. This flyer is also available on our website, and it basically describes what a Transplant Trailblazer is. This is going to be a patient who is familiar with the transplant process, maybe someone who's got listed and is still doing dialysis, but they can actually be a trailblazer as far as, talking to other patients about how the listing process and the workup process actually looks like and help some of those patients navigate through that. It can also be a patient who is already transplanted and who still has ties and connections with some of the patients in your clinics. So please feel free to use those patients to your advantage. But this is going to give you a quick guide. There is also a guide for the actual facility role that is on our website, and that will be facilitated to you through our portal. So, like I said, the PAC members, our patient advisory committee through the network, we're going to host virtual webinars, and the first one is going to be actually on January 12th at 12:30. So we will send reminders, and please, please pass this information to your patients, because the goal is for your patients to attend these interactive webinars and interact with our patients at the PAC here at the network. So we're helping you guys achieve this goal by connecting these patients with other patients who are experienced in these areas. Then one of the requirements is that you recruit at least one transplant trailblazer. Again, this is a patient who is engaged and is willing to learn to share their experience about transplant or getting on the waiting list with other patients. And you need to have that ready by December 31st. All this information is going to be reported in a monthly survey. We will not be collecting patient-specific information, but we need to know that you have at least one patient who is helping you with that initiative. And with that, I am going to pass the ball. Actually, I'm just going to advance the slides. And Arlandra, you can unmute yourself at this point and you can take over the rest of the presentation. Thank you.
Hi, good afternoon, everyone. For the Kidney Transplant Hub is a patient guide with resources for patients to consider transplant as the preferred treatment option for kidney failure. The Hub provides a multitude of resources for patients for each step of their kidney transplant journey. So as you can see, there's a bunch of topics on the bottom where patients can find out what a kidney transplant is, the facts and the myths, what's the process of getting on the wait list, how to stay on that wait list and stay healthy, and the options on how to receive the kidney sooner, such as finding a living donor or possibly considering a high KDPI and an increased risk kidney. They can also find resources that they'll be able to connect with the community to see that they're not alone. There are other people that are going through this or that have gone through this, and resources on enjoying life after a transplant. Next slide. So for the portal, all the requirements and resources for the Transplant Change Package are located on the modality portal. Danny, do you want to click that so we can give them a brief overview of it?
Sure, let me
Um,
see.
okay.
I'm gonna have to probably stop sharing this presentation and go back to sharing my screen, which is fine. It will just take me 1 second, and I think it will be helpful because people are asking, and so I think this is a good time to do that. But just bear with me for a moment. I'm pulling it up as we speak. And what I'm going to do is grab this screen, move it over, and I'm going to share my screen. Okay, so there it is, Orlando. Can you see it?
Yes, I can. Great.
Okay, perfect.
So just a reminder that you only need to complete the items on the right side of this portal. So anything that is in green, which is the Transplant Change Package. You're more than welcome to check out the home section on the left side. There are useful resources that can also be beneficial to your facility as well. And Dana, if you scroll down, you can see the upcoming events and due dates. Right here, we'll post anything that's coming due or any webinar that's coming or even a recording such as the TX Connect webinar that we did last week. We'll also, the feedback form, if you scroll down, is going to be located at the bottom. And as Danny mentioned, this is going to be due at the end of each month. And as you can see, there's a December feedback survey. So it'll be due on the 31st. And if you keep scrolling, there's an other resource tab that lists a numerous transplant and home resources that you can use to educate your patients
And
and,
stop.
and staff. Sorry. And then you can see we've posted all the interventions are on here, such as the KDPI video, our patient portal that I'll talk about here shortly.
Orlando, how do we access the portal from the website? Do you want me to pull it up real quick so we can show them?
Yes, even actually on that, if you scroll down, there's a link and also a QR code
Okay, let me see
that they
here.
can scan with their smartphone camera.
Okay, now if someone is on our website, where do they find the portal?
So if you scroll down, it's going to be on your left-hand side and it's going to say patient portal right below
Right here.
patients and families. So if you click that, it will pull up a portal.
Okay,
And let it load.
all right.
Okay, and then if you scroll, we have all these numerous resources that you can click from upcoming events, and you just click the tab and you can find resources for every category. And then to mention, we also even have an Espanol hub for our Spanish-speaking patients.
Okay. So to access the portal that we just showed, do we just go through this portal right here?
Yes, our modality portal there at the bottom is also a link and a QR code that they can scan
Okay,
from their phone.
sounds good. I don't know why this is not letting me maximize. There we go.
So here's an example of our home section. And you can click on each one. You can watch a video or even access educational resources.
So are we going to we're going to email to all of you the direct link for this portal right here, correct?
Correct. And then we also have a flyer that we can send. It's on our website. We can send the link to the facilities and they can print it out and hand to the patients as well.
Okay, so if we also go to if you go to the home page, another way to get to it is to go through the quality improvement activities, which many of you are familiar because that's where we have all the projects. And then you can find the modalities and it's going to be included in there. Is that correct, Orlando?
Yes, and I think if you look on the actual portal, we've linked the flyer,
Okay,
maybe. And if not, we can always add it
yeah.
to
So
our portal.
there are several ways to get to it. So there's a lot of resources here. Here is where you can access the CEUs for the home, but we're talking about transplant. So here's the peer program guide. the dialysis role, the transplant center role. Here's the Trailblazer role. So this is the one that we were talking about, and here's the hub. So when you click on that, it's going to take you also to the hub that we recommended. So it's all on our website. And if
And
you
our
have any
portal.
issues, and our portal as well. If you have any, here are the CECUs for the two options. And if you have any issues finding it, just give us a call or send us an email, and we'll be happy to connect you and help you find it. All right, let me go back to the presentation, Orlando, because I don't want to take a lot of time. If we need to go back, then we can do that at a later time, but I'm going to let you finish your presentation. Can you see the right page?
Yes, so next slide.
Okay, perfect.
And we can advance the slide, Danny. Okay, great. So here are examples of some of our transplant resources we have listed in the portal and that you can also find on the website where Danny showed you. As you can see, we have some that are listed in Spanish for your Spanish-speaking patients. Next slide, Danny. And for our patient portal, we have developed a patient portal with resources and videos highlighting important healthcare topics. The patient portal is not only for patients, but for caregivers and family members. It's updated monthly with the newest available resources. You can actually use your smartphone camera to scan that QR code right there, and it'll take you straight to the patient portal, or you can click the link. And here is an example of our flyer that we can link and send to everybody in the facility. Next slide, Danny. And again, if you have any questions or comments or you can't find something, you can reach out to myself or Danny. You can either email us or call us, and we'll gladly answer your questions. And that'll end my part of the presentation, Danny.
Thank you, Orlando. So I'm going to go through the chat real quick and answer some of those questions. Thank you for submitting the questions. So basically, just to recap, there are different things that you need to do, but let's go back and focus on the main interventions. The Transplant Trailblazers, so finding that patient for your facility is going to be a requirement. We want you to also share the video, the KDPI video with your patients and your staff, and then to visit the Kidney Transplant Hub and utilize some of the resources there. Another requirement is going to complete at least one of these CEU courses, and it can be one staff member, but if you want more than one staff member to do it, the more the better. That way everybody's more aware of what's going on with transplant. Then the other requirement is going to be to complete the monthly survey that will be available through the portal, and then to invite your patients to attend that interactive call with our PAC members. So the one for transplant is going to be on January 12th, 2021. Thank you for pointing that out, not 20, January 12th, 2021 at 12:30 p.m. And we will send that. So what we can do to help you guys have it a little more clear, we can follow up with an email later today or tomorrow, and kind of give a recap of all the requirements, and we can also attach or include the hyperlinks and all the links for the portal and how to access each of the individual sections that we are requiring you guys to complete. I think that will be helpful for you guys to have it in an email format. So we can do that for you, absolutely. Somebody's asking, where do they access this again? If they go through the intranet? No, this is not in the intranet. This is only through the network. So through the website, and within the website, you can find the portal too. So there are different ways to get through it, but it's all through our website and also through the link that we are going to send you. Next question is, are we just showing the transplant video to the Trailblazer? No, the transplant video is for everyone. So I don't know how many patients you guys have and how you can do it, but you can play it and on the lobby. You can use a tablet. You can print the QR code and give it to the patient so they can scan that QR code with their phone and they can just watch it while they're doing treatment or on their own time. I mean, there's several ways to share that. We just want the patients to learn a little bit more about transplant, and that video does a really good job making it very simple. And it's a 2-minute video, so it's short and simple, and I think it's going to be helpful for the patients. For the Trailblazer role, do we need to find someone that got transplanted already, right? That is one way to do it, absolutely, yes. So if you have someone who is already transplanted and is willing to work with you guys and, get on the phone with another patient or do some sort of virtual lobby day or connect with other patients, that's fine. And also encourage them to attend the Transplant Trailblazer interactive call that we are going to host with the PAC members on January 12th so that they can learn more and be better prepared. You can share this Trailblazer role. I know that as you can see here on the Trailblazer role, the step one, it says sign up to be a transplant trailblazer through your transplant center. That is a suggestion in case the transplant patient wants to work directly with the transplant center too and help some of the patients there. But there's really not a sign up per se, but it's just a recommendation to notify the transplant center and see if they allow that to happen as well. So work with us. We're here to work with you. Attending the kickoff meeting, that's basically today, and also the Trailblazer interactive call that we're going to have. Then supporting that patient who's willing to volunteer to help you guys, just brainstorm with them and come up with ideas. We're kind of leaving it open to you guys to do it the way that best suits your needs, and we don't want to be super prescriptive about it. That's why we're giving you the initiative to do it, and also giving you the tools and the resources to accelerate that process perhaps and be successful. Let's see. Next, is this video in Spanish too? It is not available in Spanish at the moment, but I believe there is an option. Well, I don't know if there is an option on YouTube or whatever platform this video is on to do subtitles, but that is a good question. And we already asked the NCC, and hopefully they are working on making this video in Spanish. So if it's available in Spanish, we will post it and we'll notify the facilities. As far as creating a flyer to give to the patients about the Trailblazer is already there. I don't know about the interactive call, but we can probably put something together real quick and just send it to you guys as a PDF, maybe with a link so that you can just print it and give it to the patients to promote the interactive calls with the pack. And the goal is to do at least one of these interactive calls once a month. We already have an agenda and some items that the patients actually want to discuss from a patient perspective. And whoever attends this call is going to be able to interact and will have an opportunity to ask questions and comments. Yes, you will get a copy of the slides. Actually, we're going to post them on the website. And so you should be able to access the slides and this recording as well. Yes, you can have a patient that is on the transplant waiting list to be a trailblazer. So you can have as many Trailblazers as you want. Obviously, the more you have, the better. But yeah, so one example will be a patient who got a transplant and is willing to help you guys motivate other patients to get a transplant. Another example of a trailblazer will be a patient who is still doing dialysis, but went through the transplant process and now is on the waiting list. So that patient will actually be a perfect trailblazer to help other patients um, go through the process. Tell them what the process looks like, what are some of the barriers, what are some of the expectations, what did it look like, and just kind of be there as a support partner, if you will, to help all other patients get through the process of waitlisting. I'm going to go back and see if I want to make sure I'm not missing any of the questions that you guys have. So just bear with me for a moment. We're almost done. Yes, the slides are going to be available. Yes, I'm just reading here. Yes, we will correct the date. So yeah, it looks like I cover all the questions, hopefully. But if you have any other questions, give us a call or send us an email. I'm going to go back to the last slide so that you can see our contact information. So you can send us an email or give us a phone call For me personally, I think email is better. I'm not always in front of the phone or sometimes in meetings and I may not be able to answer right away, but if you send me an email, I will get to it as soon as I can and I can reply and send you whichever information you have. Somebody's asking, how does the Trailblazer communicate with the patients since we cannot do lobby days, obviously, due to COVID. That's why I said, get creative. You can do a virtual lobby day, maybe set up a WebEx, a webinar, maybe even if the patient is willing to share their contact information with other patients, as long as everybody's on board and agreeable to that, you can do that and connect those two patients and kind of like a peer mentoring program so they can talk to each other at their convenience. And so, yeah, just get creative with that, and that's another reason why we are providing the pack um, interactive calls because we understand that there are challenges since we cannot do lobby days at the clinics anymore. And so having access to another interactive opportunity, it's great. And so in that case, if anything, you can encourage the Trailblazer to invite other patients to attend the interactive calls that the network is hosting and is going to be led by patients. So it's going to be um, uh, by patients, for patients, and everybody can participate. I think that is it, unless there are any other questions or any other comments, Arlandra.
There's actually one more. Someone asked, can you complete the survey before the due date or before the end of the month, for example, if they go out on PTO? And the answer is yes. You can complete the survey before the end of the month.
Yes, we want you to ideally wait and do as much as you can throughout the month. So when you complete it at the end of the month, you have everything you needed to report. But if for whatever reason you're going to be out, you can either delegate to somebody else to do it, or you can just complete it early. As far as the survey, it's at the bottom of the portal, as we showed you earlier. When you scroll all the way to the bottom is one survey, and it's the same for home and transplant. So you will just answer the questions and you will select transplant before you submit the survey. But we will include that link in the follow-up email that you will receive. Okay. It looks like the helping patients prepare for the kidney replacement therapy is closed. You can no longer register for the course. Okay, let us look into that one because it was working yesterday. So if that's not the case, then we're just gonna have to complete the other one, the one that is open. Only one is required. If for whatever reason this organization decided to shut it down, then there's still the other link to complete. So let me go back and look at that. But I'm gonna double check just to make sure. Yeah, so if this one right here is not working for whatever reason, then try to complete this one in the meantime, and we'll see if we can get this one reactivated or if we can find a replacement for those EEUs. But in the meantime, if that's the case, please go ahead and complete the NKF's transplant rejection. Thank you for pointing that out, Robin. All right. Well, I'm going to stop the recording right now, and we will post this recording and the slides as well as we will follow up with an email. And we're looking forward to working with you guys. Thank you for everything you do. And again, if you have any questions, we are on the same team here. We have the same goals, which is doing the best for our patients, getting them to do to get listed for transplant and perhaps get off dialysis. But we're here to work together. We're passionate. We both work in clinics before, and we've been PCTs, and I was a nurse, and we're just passionate about this, and we know that you guys are too. And so let's work together. Let's work as a team. Anything we can do to help, feel free to talk to us. Um, so we're here to work with you and to help you achieve the goals that we both have. So thank you again. Have a wonderful rest of the day, and we will be communicating with you guys soon. Thank you.